welcome to Nursing Made Easy. So today we will be learning about head assessment. So whenever you are starting a new system, you always have to do what? Inspection. So start with inspection. So whenever you're inspecting the head, make sure to observe their head size. So like for my head size, I can say that so your head size, it looks normal, which we call the normocephalic. Cephalic means head and normal means normal. So normocephalic head, and like observing your head, your hair looks nice and tidy, and I do not see any signs of obvious trauma, no any indication of soilings or anything at all. So now I'm going to be palpating your head to see if there is any kind of skin lesions or any abnormalities or any lumps. So feel it, and just like this, and you can say that your I do not feel any kind of lesions, no any soilings, no any kind of abnormal masses or any lumps in your head. So that completes your head assessment. Now we are moving towards your face assessment. So looking at your overall facial expression, I can see your facial expression is calm and respectful, no any signs of agitation. So we did this earlier in our neurological assessment, but we need to do it again. And the next thing I'm going to be doing is your assessing your cranial nerve number 5, which is trigeminal. So for the cranial nerve number 5 trigeminal, what I'm gonna do is it has two components. One is motor and one is sensory component. So for the motor component, you can ask your patient to push their chin below your hand to see if it's working or not. So put your hand like this and ask them to open and close their mouth like. So you can say that your motor component of trigeminal nerve, which is cranial nerve number 5, is working. And for the sensory component, you need to put something on their cheeks, maybe like a soft cotton or like a pen. You can put it, and you have to tell your patient to close their eyes, and you have to ask them to describe it, like how they feel and where they feel it. So put it here and and let them close their eyes, and you can ask them like, tell me what do you feel and where do you feel, and the patient can say, I can feel like a sharp thing, maybe like a pen, and I can feel this in the right side of my cheek. So yeah, that is correct. So perform here, 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 and you can say that your sensory component of your trigeminal cranial nerve number 5 is intact, it's working properly. And the next thing I'm going to be assessing is your cranial nerve number 7, which is facial nerve. So for that, you have to see their facial movements, if the facial movements on both sides are working properly. So for that, you can ask your patient first to smile, frown, puff up their cheek, and make their eyes wide open like this. So see that, and if they are able to do it without any difficulty, you can say that your cranial nerve number 7, which is facial nerve, is intact. And I can see when you were doing the facial expression, your both sides were symmetrical. And I forgot to say you one thing, like whenever you are inspecting the face, you can say that your facial expression is calm and respectful, and I do not see any signs of hemiplegia, that is one face drooping down. Your face is symmetrical. So this thing you have to make sure to keep in mind. So yeah, let me see if I forgot something to tell you. I don't think so. Skin color, hair assessment, cranial nerve number, facial nerve. Yeah. Okay, so I forgot to tell you the other thing that we have to do is palpate the sinuses and the artery. So for this temporal artery, this frontal sinuses, maxillary sinuses, and the TMJ. So you can say that now I'm going to be palpating your temporal artery, which is located at the temples, to feel the pulsation. So just put your 2 fingers here and feel their pulse and the temporal artery, and you can say that I can feel the pulsation, no any abnormalities, no any lumps here. And now feel the frontal sinuses, which is located just above the eyebrows, and you can say no any lumps here as well. and the maxillary sinuses, which is located just above the cheekbones. You can see that I do not feel any lumps here too. The maxillary, the frontal, the temporal arteries, and the other is the temporomandibular joint, which we also call TMJ. So it is located just front of your ears here, and you can put your fingers here and ask your patient to open and close their mouth. So here we are looking for the signs of crepitus, which is a crackling sound. So tell your patient to open and close their mouth, like, and you can say that I do not hear any signs of crepitus or crackling sound. Your jaw movement was smooth, so your TMJ is working properly and is intact. So that completes your facial assessment.